Hello, everyone. Good morning, good afternoon, and good evening, depending on where you're watching from. My name is Dr. Fiavi, and welcome to my channel, Body and Mind Unplugged. Have you ever left the hospital or the doctor's office feeling unheard, dismissed, or completely left out of your own plan of care? That deflating feeling isn't just in your head, it's real. Unfortunately, it happens more often than it should. Today's discussion is a continuation of our podcast from last week where we explored therapeutic relationship. In this episode, we're diving deeper into a critical question. How does provider bias affect overall quality of care, and what can we do about it? To help unpack this important issue, I will be speaking with two incredible healthcare providers. Dr. Adam Klose, who will be joining us a little later. She's in California. She's also the founder of Nku Foundation, an NGO dedicated to providing free eye care services to underprivileged communities in Ghana. Also joining me today is Dr. Onyalo. She is a two-time board-certified nurse practitioner specialized in family medicine as well as psychiatry and mental health. She's also a humanitarian healthcare provider who is a patron of my very own foundation, Health for All Foundation. Well, we can't truly address this topic without hearing from the people that it impacts the most. So we'll be joined by two gentlemen who will share their honest perspective as patients, Mr. Kobla and Mr. Abdul. Get ready for an eye-opening conversation about the gaps in healthcare and how we can bridge it together. Ladies and gentlemen, welcome.
Thank you.
Thank you.
Dr. Onyalo, we've heard so many times, and research has supported this, that patients, minority patients especially, always feel unheard, dismissed whenever they go to the doctor's office. Why do you think we have this bias in our system? And how do we go about it? As a minority provider, have you ever experienced a situation where your minority patients or even white patients feel like you've not given them your best? In a flip, do you also feel like because of this research and this provider bias, you pay more attention to your minority patients so they don't feel that way, they don't feel excluded in their plan of care? What is your experience? Do you mind sharing that with us?
I think from the provider perspective, there's what we call, most of the time we go through this training called cultural competency course that we have to take in order to bridge or to understand how we have this the implicit bias comes in. So personally, on a provider perspective, I think the feeling of the patient being unheard comes from a communication issue, or there's that communication gap and the level of understanding of the patient. So I have to come down to the patient level and communicate in their level that they are able to understand and also willing to answer their questions. I usually tell my patients that there's no stupid question. If you care to ask, then it is important to you. If I don't know the answer, then it is my job to find out the answer to your question and get back to you. But totally dismissing the patient's question puts you in a place of they don't trust, they'll come not to trust you because you didn't listen the first time, what makes them think you're going to listen the next time? So we have that first opportunity shot to be able to attend to our patient to the best of our knowledge and ability. And you can't attend to somebody without listening to them. I remember in school we were told if you only listen to your patient, they will tell you the diagnosis. So then you don't have to work hard looking for the diagnosis because they know what is happening. So if I only listen to them, then they will tell me what is the problem. I remember years ago starting out as a nurse practitioner in a rural setting. I had this gentleman that the patient was supposed to have a surgery. He had surgery scheduled, but he went for pre-op, and the surgeon said, I cannot do surgery on you because the blood pressure was so high. So then they say you have to go control your blood pressure before I can do a procedure. So he came back. The first time I said, so what's going on? He said, oh, they say they can't do my procedure because my blood pressure is so high. So I said, what happened to your medication? Oh, I stopped taking my medication because I had a side effect of the medication. But when I complained, they increased the dose instead of changing the medication. So what he did, because he felt not at that particular point, he chose to stop taking the medication completely. For several years, he didn't take the medication. So when he came back, I was like, okay, your blood pressure is so high, I can't even treat you. I have to send you to the emergency room. He said, no, I am not going to go to the emergency room because he had the local emergency room had like, I don't know what the deal was, but the reviews were not good. Let me put it that way. So he said, what can you do? I said, I can treat you, but I need it to go. So he said, okay, can I stay in the clinic longer? I said, but I have other patients. I can't keep you here forever. So he said, okay, but I can give you the medication only if you promise you're going to come back. So I had to kind of cover for the
Build
other
their
person.
Build a rapport.
I have to cover for the other person that, okay, we're going to work this out, but I want you to come back in like 2 weeks and see where we are. So what I'm not going to do is to give you medication for a whole month because then you're not going to come back. So over time, we were able to build this relationship to the point that he will only come to the clinic if somebody is gonna listen. Otherwise, he will come and see you are not listening. He gets back to his car and go back home. So this tells you how when we ignore those little things of I'm coughing from this medication, so you say, oh, it's gonna go away. But not everybody is willing, not every patient is willing to go through the side effects of certain medication. So in a situation where we have other options, why don't we explore another option for this particular patient and see if we're going to achieve our original outcome, which is to lower the blood pressure? So those little things, at the end of the day, they matter. So on a provider perspective, I think being more understanding and communicating clearly with the patient will kind of minimize that biasness that we see between the provider and the patient.
Wow. I think I kind of agree and I can relate to that because it's very blunt to just hand over medication to a patient and just say, well, you may experience these side effects. But I think that active listening and explanation and taking a step further by letting the patient know that, yeah, you may have these side effects of this medication. But before I put you on a medication, I have already weighed the risks and I know the benefit outweigh the risks. for your health. That is why I'm suggesting this medication. And more often than not, they listen and they're very compliant when you go that extra mile to explain and have the time for them and not just rush them through. So thank you for that insight. Mr. Abdul, can you share your experience with us from a patient perspective? Living in Sierra Leone, what has been your experience going to the hospital or seeing a doctor? Is it positive, negative? Is it
Yeah,
mostly negative? And do you have any experience to share with us?
yeah. I mean, I would say both positive and negative,
Mm,
but I'll report on the negative because that's what affects me most.
mm,
So I have two experiences, with Sardinian doctors. The first one was I was at college, and Sierra Leone, malaria is very, very endemic, so
mhm,
always malaria, so it's very common. So uh, I experienced malaria because it's very common to us, so we already know the symptoms itself. When it started feeling, that way, you suspect that it is malaria, so you go to the chemist shop and get some medication. So sometimes when you take those medications, you get cured. So based on that experience, uh, I had a similar experience, and so I went to the chemist store and shop and got that medication. I took the medication as prescribed, but I didn't get ill. So I went to see a doctor. So I entered his office after I had to wait for more than an hour. I entered his office and he asked me what's my problem. I started explaining. I said I'm experiencing malaria symptoms. I say um, I've taken this, I've taken it. So he stopped me right there. He could not allow me to explain myself, saying that already I know what is affecting me. Why do I have to come to him? Just because I said I'm experiencing malaria
mm,
symptoms. So he got offended
mm,
that, gentleman,
mm.
please leave my office, go and continue your treatment. You already know what is affecting you, so there is no need to see me. So
Wow.
like, I paused for a while, you know. I still sit there. He asked me, go out. There are other people waiting for me. I could not believe this. So like I feel so bad that I was going to ask for the medical superintendents and report this matter. So I came out. There was this nurse whom I spoke to before I entered the doctor's office. So I explained to her how the doctor treated me. So what she said was, that's his problem. That's what she said. He said that's the doctor's problem. He said he's not very patient with people. So that's why he told me. So what he advised was that he directed him to another clinic where I went the following day and got myself treated. So that's my first experience. I had another one in 2022. I was experiencing you know issues and that was not seem to stop. So I went to see a doctor. A medication was prescribed for me. It got better when I was taking the medication, but um uh uh just after I completed the medication, 3 days later, the itching starts again all over. you know the full cup of that medication, So I was taking that medication, then I started experiencing, like my face and my feet were swelling up, So but I did not know that it was the medication that was affecting me.
Mm-hmm.
Yes, so but I kind of suspicious of it, so I sometimes I don't take it. So the itching was still going on. So I went to see another doctor at a public hospital in Sierra Leone again. So I went there. I started explaining my experience from the first doctor, so what I'm feeling. The same thing, the doctor couldn't listen. I wanted to run some tests. He couldn't listen to me. He said, "Gentleman," he said, what you told me is enough." He said, he prescribed some medication that I should go and get the medication. So I wasn't satisfied. I wanted to run my tests. I wanted him to send me to the lab to do my test so that I know what is affecting me, because I've went to a doctor, that does not, my problem did not seem to be addressed. So like, I have to go to him again. So hoping that, he will treat me, the way I wanted, so that I get cured from this thing. So after I started explaining, he couldn't allow me to finish, so he just prescribed some medication and sent me, to a chemist store to get the medication. So I went, I did not deny, I went, I got the medication. She tells me to use the medication for 2 weeks and come back to him. So I went, the problem did not seem to subside, even though I was taking the medication. So after 2 weeks, I came back, hoping that this time around you will help me to run my tests, or, tell me something else. So when I get to him and I explain how I was feeling when I was taking the medication she prescribed, he just changed the medication.
Mm-hmm.
He changed the medication this time. Say, "Okay, go and try this one again." I said, "But doctor," I wanted to run some tests so I know my problem. He said, "No, you don't need to run the test." He said, "From what you told me, I know what is affecting you." I said, "But the last time you prescribed some medication, I didn't get, cure. So why are you, convinced that, you know what is affecting me without running my tests?" So he asked, he said I was trying to argue with him. So he called, in Sierra Leone, when you want to see a doctor, there will be somebody standing at the door who will call out on patients to enter the door. So you just call the person that, "Please call me another person. Gentleman, get out of my office." This was the second experience I have. So I went out, with mixed feelings. So I stay at the provinces in Sierra Leone, so that got me to travel to the city, to see somebody else. So I went to this hospital. It was a hospital run by Southern Arabian, the Arabs. It is called in Sierra Leone.
Mm-hmm.
I forgot the name now. It's a very popular hospital, So I went there. It was very expensive. So thank God, the doctor I met was able to listen to me. I have to explain everything, and he has to, write some tests. He wrote those tests that I should run them, and the following day I should come for my results. So I did the test, then the following day I came. So he did not find out anything that was worrisome. All he said was that maybe I'm taking, or I've been taking something that is not in agreement with my system. Because I was worried that it has to do with the hepatitis, or even though I've taken the vaccine, because I was swelling up, my feet were swelling up. So I was worried. So like after the test came out, he told me that no, he say, I mean, there is nothing to worry about. He say hepatitis vaccine is still active. He say I saw it. He say there is nothing to worry about. He say it could mean that you are taking something that is reacting on you. So what he did, he prescribed some medication too, and asked me to be taking them and see him again after a week. So I did that. So he asked me to stop the previous medication that I was taking, just to concentrate on that one. So I did that. So I started seeing some difference. So I went the other day. I explained myself, how it all went. So like he just add some medication from the previous medication, just add another medication.
So
So that,
basically, you felt unsupported by your doctors, and
yeah,
you felt like they didn't hear you. But
yes,
when you went to the private hospital, the
mm-hmm.
experience was different.
Was different. Yes,
Would you
this
say it's
person was.
because it's more expensive and you have to pay hard cash? The experience is better. Would you say that's why? W-
Yeah, well, I
Mm.
have two explanation for it. One, I thought because he's a foreign doctor, he may be properly trained than our doctors in Sierra Leone in terms of ethics or in terms of how you treat your patients. So, and also, I also have the feeling that he has to listen to me because it's very expensive to see him as a doctor. So he has to listen
Mm.
to me, you know. So I have that kind of explanation about him.
That's an interesting insight, an interesting perspective. Thank you, and hold on to that thought. Let me hear from Mr. Sam Kovler. I'm sure your experience is different.
Yeah, I actually have not really experienced any bad vibe with a doctor or a provider I've seen. Um, it seems pretty much providers I've seen in Ghana, I would say first, mostly have been people I've known, like friends. And I'm blessed that I haven't really had very serious health issue that I need those thorough, you know, diagnosis or tests runs back home until I came here. And that one, when I was back home, it was migraine that I suffered. But even with that, the doctor I saw at that time was my pastor. So, I mean, it was straightforward, smooth. And all he mentioned was sometimes when you are going through these headaches, the best place to or best provider to see is somebody who works with psych sometimes. But when they talk about psych, then we all think we will be considered being mad or have psych issue. But I said no, they are specialized more with, I mean, the head and those stuff. I went there and it was, I mean, I met a pleasant provider as well, but that headache never left until I came to, I mean, the migraine never left me until I came to US. I did 2 CT scan about it, 2 MRI within like 2 years, 3 years. And it still remained like that, but miraculously it disappeared. But the neurologist I saw here was very nice. I mean, I didn't see anything showing bias because I could see that she has a lot of experience. She's doing whatever she could to help me get out of this migraine. But I believe you providers know how migraines behave. It's not easy to really pinpoint what is creating the problem.
Right.
But luckily enough, it has disappeared miraculously. So, but I have not really had very bad experience with providers, and most providers I've had gone to has been very pleasant. I don't know if it has to do with how I can get accustomed to or I can relate to people very easily. It doesn't matter the where, when, condition, I mean situation. I can go somewhere and immediately get myself accustomed or used to whatever is there to behave like a long time friend already. So I think sometimes that has also helped me. But I have not really had any bad experience with provider.
Well, that's good to know, and I'm happy about that little, pick about psych providers. You know, I think that's one thing about being a dual board certified provider, as a provider who specializes in family medicine as well as psychiatry. We are able to navigate or address issues through a more holistic lens, because we see the individual as a whole, both physical and spiritual and mental. So thank you for that insight. Would you also say that you do something special, different before you go to um your appointment? You've done some research, you've done some homeworks, you know exactly what to ask your providers, and you go straight to the point and ask those questions that make your communication with them smoother?
I believe this question is for me or Abdul. Is it
Yes,
me?
it's for you.
Okay.
Yeah.
Okay. Actually, most of the time I try to uh, what word should I use? I try not, I wouldn't say investigate, but I try to know much about what is going on with me before I go to my
Mhm.
provider.
Mhm.
I do research. I should use the word research. I do a lot of research before I go to provider. But sometimes you make a research and you go and it doesn't fall the same. But I mean,
Yeah,
as
because like
doctor,
we tell our patients that Dr. Google is not always accurate. So
exactly.
yeah.
And as Dr. Onyalo said, it depends on what you tell the doctor, and that will lead the doctor to know what type of tests or diagnosis and those things that should proceed to be able to really help you. And again, I've been very fortunate to have friends and family who are on the medical field, providers. So sometimes when something is happening to me, before I even go to my provider, there have been little discussions somehow. And I'm very, very, I would say, health conscious. So as soon as there's something wrong, I know there's something wrong. So I start talking with few people and as well do few research. So by the time I get to my provider, or if he has to do with urgent care, normally it's not my provider. So I'll go and discuss what is happening. But like I said, I'm very easygoing with meeting people. So provider may come in, even I could see being very busy. I may say something that will just let the provider smile and make things relax for both of us to communicate, because it's reciprocal on when you are communicating, how you start, and that's how the person will respond. And I do believe that no provider who is very passionate about his or her job or very concerned about patients would like to just let patient go without experience good treatment. But unfortunately, back home where we are from the experience of Abdul is there. I wouldn't say it's not true. We meet people in Ghana too that I believe they might also have similar experience. When you go narrating or telling them what you are going through, they feel like you think you know, so why are you here? It's not the same to here. Here, you can be sued at any time easily on certain
Mm-hmm.
things. So people are more careful to protect their licenses and all those here than back there. And customer service, pretty much, patient provider relation here is better than third world countries or where we are from.
Mm-hmm.
So mostly, like I said, I do research before I go. So I go straight. This is what I'm feeling. And when providers say, "Oh, can I'm writing this test and this test and that test for you," if I have something also in mind, I also chip in and say, oh, do you mind if we add this one? And most of the time they will say yes, when it's not going to violate what they need to do in order for insurance to cover.
Mm-hmm.
Because you can't jump straight and say, I need MRI when you haven't gone
Exactly.
through,
To
you have not
X-ray.
gone through x-rays and those stuff.
Mm-hmm.
So when they want to start from here, I know, yes, these are the procedures they need to take before. So if I go and do it, sometimes I will know that maybe the x-ray wouldn't really work, but I still have to, allow that to go through. And by the time you realize if it's not working, you go back and you say, hey, I've done this, it didn't work. Straightforward, they can say, okay, let's do either ultrasound scan, or they can go straight to MRI and you get it done. And my primary provider, I've been with her for some time. So we have a very good relation, provider patient relation. We have a very good rapport. So what I do mostly, if I'm going for annual checkup or wellness, I request for the tests I need to do before going. It's not everybody. I don't think all providers do that if you don't have that long time relation with provider.
Relationship with them. Mm-hmm.
Exactly. But because I've been with the provider for some time, I request for the lab test, or if urine, whatever test I need to do before going. And the provider's nurse will call me and say, hey, we have put in your request. Or they will send me a message, I put in my request. So I'll go and do it before I go and see my provider. So I've had very good experience with most providers.
Okay. Wow. Thank you for that great insight. Dr. Adam, welcome.
Thank you. Can you hear me?
Yes, I can hear you.
Sorry, I disappointed you guys. Just woke up.
No, it's okay. So we are almost wrapping up because we don't want today's podcast to be too long. But it's a very important discussion. We are
Right.
talking about we've talked about therapeutic relationships, provider bias and its impacts on healthcare. We know that research supports this clearly, that minorities feels unheard or dismissed or disregarded when their concerns are relayed to their providers.
Mm-hmm.
As a minority or a Black African provider, doctor, do you feel like you always have to go the extra mile when you are seeing your minority patients so they don't feel that way? Or you just treat them like you treat your white patients or Caucasian patients?
Right. So I think the problem fundamentally comes from limited number of Black providers also. If we, like, when I see my patient and I'm Black, it's like there's that joy of like, one of ours is here. I
Mm-hmm.
always get that experience. Oh my gosh, like it's not just always like the Indian doctors or like the white person or white doctors. It's more like one of my own is here, and just the interaction is different, to be honest. Just like yesterday, and of course I treat everyone the same,
Mm-hmm.
but I mean, I don't know. When I go see the white patient, the one question they ask me is, "Are you my doctor?" And I'm like, "Yeah."
Mm-hmm.
And I asked them, "Are you okay with me seeing you?" I mean, because at the end of the day, you are the one sick, not me.
Mm-hmm.
So if you're okay, I always ask their permission. If you're not okay, because I've had that experience before when I was in Boston, a white woman was like, I don't want to see you. And I said, you're absolutely right. I mean, it's not forced. It's not by force for me to see you. So whenever I go into a room and it's a Black person, some people say, you look so young to be a doctor. I'm like, being a doctor is not in appearance. It's about the knowledge. But I feel like when I go in to see a Black person, they are more open to giving me more information, and they feel comfortable. So I'm also able to discuss things like advice. Like, for example, just last night I saw a patient who has diabetes, is very non-compliant. So it's like usually I leave the education at the end when they're about to be discharged, because I'm like, then you are ready, your mind is set. But I'm like, hey, listen, I'm doing 9 duty. I don't know who will see you before you leave, but this is what I think you should do. Like, I took the time. It was almost like 45 minutes I was with one patient.
Mm-hmm.
And the wife was just like, tell him. Yeah, he needs to hear that, because how many people will spend the time to want to just explain to you about insulin, explain to you about eating right, your kidney function, all those things. Like, people just think they're just separate. I'm like, no, just because of one sugar is gonna affect this, it's gonna affect that, it's gonna affect this. You can't be walking around without socks. You need to always protect your feet. And the wife was just like, doctor, please tell him, like, how many doctors will come into the room and take that time,
Yeah.
so I spend a little bit. Do white people feel like I don't spend time with them? I don't know. I think I'm always generous with everyone, if you allow me to be. But what black people feel unheard, sometimes I feel maybe they've had their own experiences.
Mm-hmm.
So when they see one of their own, there's like I don't know, there's a little bit of relief. I wanna say that
Mm-hmm.
this person will hear me. Not, they wouldn't think I'm only here because I'm pain seeking. They
Right.
will listen, they will hear, and me, yeah. I know some people too who are pain seeking and come 24/7. So we have to draw a balance, and between when it's a good time to cut all the pain medication versus just or this is the thing, like, so they come to the hospital and they know exactly what they want. I want Dilaudid. I want morphine. And I'm like, have we tried Tylenol before? Like, we can be going high, but we
Mm-hmm.
haven't tried, because they're all used to, like, oh, I don't want to feel any pain. But I'm like, how about your blood pressure is going down? We just can be giving you, because this works. We have to, like, put things together and strike a balance, So yeah, like, I think I don't know. I think
That's
black people feel
interesting. That's
comfortable.
very
Yeah.
interesting. So basically, your experience, which most of us can relate to, most Black providers can relate to. I'm sure Dr. Onyalo can also relate to that reverse bias from patients. They
Yeah.
see you and automatically they either assume you're from housekeeping,
Oh, yeah.
or you are not qualified enough to be their healthcare provider. They already have their own prejudice. They don't want you to see them, or they just don't want you to be their provider, which is fine. It's fine when they can tell me that I
Yeah.
don't want you to be my provider. But it's difficult when they sit in your office and then you spend 45 minutes with them, and sometimes you're still not able to break through that barrier, and they still see you as um, somebody that is not on their side. I'm not sure. I don't
Yeah.
know.
Yeah. Mhm. I think I've also grown a tough skin to a lot of these things. So, like, at the
Mm-hmm.
end of the day, I'm
You are
here
at
to,
the end of the day, you are the provider. You still have to do your job.
yeah. So whether
Mm-hmm.
you want, and I always tell them, please, you're more than welcome to get a second opinion. I'm not the final say. If you don't feel comfortable, or you feel like I haven't really addressed your issue, you're more than welcome to see another provider. Like, I give them that option. Like, what are they gonna do different? They're seeking for something that I'm like, I'm against, or I don't think is good for them at this time. So, yeah. But then
Thank
again, yeah,
you.
we need more Black doctors, period. We need more
Mm-hmm.
people who look like us to get in the field,
Mm-hmm.
because, like, before, I mean, I've been to hospital where there are white people. Like, I'll take my mom, like, I wouldn't go to the appointment with my mom and say, hey, I'm Dr. This. So, no, like, I just listen and I give them information. I was like, have you done this? And then they ask, how come you know much? And I'm like, oh, I'm a doctor. Then the relationship changes. That is true.
Mm-hmm.
My mom can talk about that, not me. Because it's like, when they realize, or the white doctors realize that you are a provider, their attitude change towards your relative. That is true. So, I mean, I wouldn't discount, like, a lot of Black people feeling like they've not been heard when no one in their family is a provider, or no one can vouch for them. Yeah. So,
Well, it is a fact, actually. It is a fact that, 22% of Black people are denying pain management because that they think we have high tolerance for pain, and as much as 33% are
Huge.
are dismissed or not heard when they feel like they go to the doctor and relaying their problem. So it is research actually support this, and it is a problem.
Mm-hmm.
And then when you go back home, there is this issue of communication, and providers, like Abdul said earlier, had a very bad experience with his providers on 2 occasions where they literally kick him out of the office, without
Yeah.
listening.
Ghanaian
So,
doctors will do that. I will not be surprised.
well, yeah, pretty much the whole of Africa. We've heard it. He's coming from Sierra Leone, so this Sierra Leonean perspective, which is no different from Ghana anyway. Mr. Abdul, what can we do better in 60 seconds? Tell us, what can we do better to improve on communication with our patients so they feel heard and included in their in their plan of care? Because at the end of the day, it's your health. You should be the center of your treatment plan.
Yeah, I don't know about doctors here or health providers here, but back home, I think what we need to step up is accountability. And why I say accountability, sometimes most of these doctors use prejudices. They prejudice, issues, people, they use their, I don't know how to say it, because I've seen uh, situations, where all of you will be waiting this same doctor to see him, but there will be somebody who is more affluent, come around, they just, you know, uh, take that person to the doctor. Whereas you guys, we have been waiting maybe for 2 hours, so the doctor will see him because the doctor will perceive the person to be a rich person, and that those are the kind of things I see in Sierra Leone, so that's what they do. And sometimes what they also do, like what I told you, they will not listen to you. They will just say, go and buy this medication. So the other day, I was able to engage one of the doctors. I said, why do you have to prescribe medication for people that did not go through a test? You see, sometimes some of them, when you send them to the lab, you see what they have will just do maybe for the test. You see, so you will not have some money left that's or he or she will use to buy medication. So that's why we just prescribe for them. So they go and try the medication. So if it doesn't work, they go back. That's what the doctor explained to me. But back home, I work for the Human Rights Commission of Sierra Leone. So like every quarterly, we go to these health facilities. Sometimes we go to the police, we go to the prisons to monitor the situation. What people are experiencing. So when we go to the hospital, we'll engage the medical superintendent, and some of these things we get from people, we explain to the medical superintendent. So sometimes we'll go to the wards where they admit people. So when we enter the wards, we'll ask we'll ask whoever is in there, whether a nurse, to excuse God, maybe it's for just 15 minutes for us to have some interaction with the patients. They will tell you similar thing like what I just told you, that I'm here, but they don't listen to me. They just give us what they want. So those are the experiences. So those are the things we have. So I think what we need to do, like I said, I don't know about here, but what we need to do back home or in Africa is accountability. Because some doctors will treat you the way they want to treat you. They are not even worried about whether you're going to report him somewhere. They don't care about accountability. There's no accountability. So they will do what they want to do with you, and they don't care. I think we need to step up that one, for them to be accountable, to whoever it is at the helm. If they know that if I treat this person this way, it will report me somewhere. Sometimes that will serve as a check on them the way they treat people. But there is a lot of prejudice they exercise when they are doing their job.
Thank you. Well, viewers, unfortunately, we have to end it here. This conversation can go on and on and on. I'm sure we will continue having these conversations for a very long time until something is changed.
Yeah.
When you go to your hospital, when you go to your doctor, Do your research. Take care of yourself. Your health is more important. Remember, it's about you. Be patient and ask questions and be compliant so that the doctors can also have trust in you. And for my fellow providers out there, especially those in Africa, please be patient with your patients. Take your time and explain to them. They are the reason why you put on your white coat and report to work. Explain to them so that we can have a healthy therapeutic relationship. Until next time, this is Body and Mind Unplugged. Thank you.
Thank you.
Thank you.